Hi everyone, and welcome to Atp Live Monday. This is a program where you get to ask any questions that you may have about the health of your children and get immediate answers from the pediatrician. So, welcome, and I'm just going to make sure we share the videos and pin them in the respectful places. So, thank you so much for joining me, and you're warmly welcome. I hope you've had a beautiful day. I'm also just going to do the sharing, and I will be uh, happy to start. But let me just do the sharing. Welcome as you're joining. Feel free to post your questions um, on whichever platform you're watching on. If you're watching on the Facebook page, you can drop your question as a comment. If you're watching on Instagram as well, you can also drop it as a comment. And if you're watching on YouTube, you can also drop it as a comment. If you're watching our Facebook group, thank you so much for joining us. You're welcome to just watch, but if you have a question, please click on the video so that you will be able to see your comments, because you just put your comment directly on the shared link in the group. We will not be able to see your comment, but if you click on the video, it will take you straight to the video itself, and then you can drop your comments on the video, and then I'll be able to see them on my hand here, and I'll be able to answer them. As you're all aware, this program is just one hour. It's brought to you by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is a non-profit organization in Nigeria that is committed to the health and well-being of all children globally, but most especially in Nigeria and sub-Saharan Africa, where most of our children are still dying from preventable conditions. So what we do is to empower you with the information to be able to raise healthy children. And so you're welcome. And we do that through our online platform. Where we do programs like this, ATP Live, ATP Hour on Thursdays, and we also have a Facebook group that you can post your questions there, and we'll be able to answer your questions from Mondays to Saturday. So if for any reason you're watching this as a recording, or the program is already over, remember that that is not the end. You can always post your questions on our Facebook group, and we will try and answer them as soon as we can. So thank you so much for joining us. And beyond what we do online, we also do community medical outreaches to schools, to communities that have limited access to pediatricians. And I'm sure some of you must have had some contact with us. But this year we've been going to schools, and we've been doing a lot of uh, first aid training for our students, giving them booklets and materials to act as aid de moment for them to remember what to do in cases of medical emergencies, whether in the school or even at home when they're with their families. So thank you so much for joining us today. I thank you so much for those of you joining me on Instagram. Khadija Agbola, you say good evening. It's been a long time here. Yes, thank you so much. Well done for the consistency. Thank you so much, Khadija. Thank you so much for all the questions. So feel free to drop your questions now. I think I just have 1 more minute to just make sure I pinned the questions to the top of the groups, and then we can start. So we'll start to ask your questions. Please make sure you start with the age of the child. As pediatricians, the age of the child is so important to us. We can't answer a question without knowing the age of the child. So please always start with the age of the child. If you're asking us questions about maybe being too big, too small, please always tell us the weight of the child so that we have a context. an objective evidence of whether we should worry or not. And try and keep the question short and simple. I understand you need to tell us a lot of information, but please only include what is relevant as far as you know. If we need more, we'll ask you, but try and keep it short, because if it's too long, then Facebook will cut it off and I won't see the rest of it and I won't be able to respond. And please also ask questions. Don't just tell us information about your child. Yes, ask questions. So let me know what you want me to do with that information. So, because I don't like to guess, I just want to make sure. And unfortunately, I don't have the superpower of reading people's mind. So I always want to know what exactly the question is. So then I know what to do and how to respond. So once again, welcome everyone. Thank you so much for joining me today. I got 1 hour to answer any questions that you may have about the health of your children as much as possible. And I'm going to try and do that in the next 1 hour. After this hour, you can always post your questions on Ask the Pediatricians Facebook group. We're there 24/7, Monday to Saturdays. So you're free to ask your questions. All right, Khadija Agbola on Instagram. You said my 3-year-old's urine smells so bad. Should I be worried? It depends on many factors. When you say urine smell, number one, if you keep urine for if you collect urine and you don't do anything with it after hours, there are some changes that will happen, and there will be some bacteria influx into it, and so many changes will happen, so that will smell. But usually a freshly passed urine, so if a 3-year-old, I don't know whether you may be seen in diapers or out of diapers, but if a child is freshly voiding the urine and it smells, it is not normal. Okay, normally urine should not smell at all. And so if the urine is smelling, the question is what smell? Okay, and that will tell us there are some smell that gives us some indication of certain medical conditions. For example, some smell could even be maybe from the drugs the child is taking. For example, those of you who give your children antibiotics, you would notice that sometimes you can actually smell the antibiotic in the urine, because some of it will be passed out in the urine as well. So the smell of a urine is important, because normally a fresh voided urine, not the one that has been passed for so long that has stayed in the diaper for over 30 minutes, 1 hour. So if you really want to know whether the urine is smelling or not, you need to collect it fresh as the child is passing it. And then what is the smell? So for you as a parent, it may be difficult for you to appreciate what the smell is and what it means. And so you have to take the child to the hospital. The doctors and the lab scientists, we actually smell urine. Yes, we smell urine. It's one of the tests we do on urine. And the kind of smell we get, there are different kind of smell, but most of those smell we describe with products from among Caucasian countries. So most of us may not be familiar with this kind of products. So, but there's a kind of smell that we will get, and it will help us to know what we should investigate the child for, maybe for some metabolic conditions and all that. So if your child is always passing urine freshly voided that are smelly, you have to go to the hospital, you have to see a pediatrician, and they will recommend urine tests for your child. And as part of that test, they'll be able to tell you what they think is wrong with the child. So, Khadija, that's what I'm going to recommend. You need to see one of my colleagues, and then they will take it up from there. Okay, so still on Khadija, you are asking, my 8-month-old won't eat any baby food. Okay, I will pause there and say there's nothing called baby food. Okay, food is food. All right, so the so-called what parents tend to call baby food, you are talking about things that you buy in the shops. You're talking of things that people have packaged and they sell to you as a quote and unquote baby food. They are just the same food you have in your kitchen that somebody has processed and put in a can for you. So you don't need to give your children so-called baby food. You don't need to buy anything from the shops for your 7-month-old or your 8-month-old. What you need to give your 8-month-old is still the same breast milk you should have been given for the first 6 months, and the same food that you have in your kitchen, the same yam, the same rice, the same everything you eat. That is exactly what you need to give to your 8-month-old baby, the same food. What you need to now worry about is the way you make it. So usually when you are starting babies on complementary food, as we call it, you start with soft semi-solid, the texture usually is soft and, at the beginning, and as the child gets older, it becomes more solid and maybe, you know, other texture, and that's what you need to give. Then the quantity and then the frequency. So if you who need more information on how you do complementary feeding, you have to go to our Facebook group or and go through our guide section. We have about 6 7 videos for you to watch on how do you feed your baby, because I found out that most of the problem we have with our babies is because most of us don't even know how to feed our children. So we always have a lot of wrong assumptions as regards to feeding children, and it starts with all this so-called baby food. So because of that, we have those videos made by Global Health Media that tells you how to feed your baby from 6 months old, because the first 6 months all you need to do is to give your baby breast milk and breast milk only. From 6 months, breast milk will not be enough. So you give breast milk and food, but food from your kitchen, and you can now know how often you need to feed them, what you need to combine, what are the different classes of food, how do you mix them together. We've had loads and loads of sessions on our ATP Hour on complementary feeding. You may also want to watch them as well. We have articles on our website. We have a podcast on complementary feeding, how to feed your baby for the first 1,000 days. You really need to watch or listen to this as well so that you have the information, because one of the challenges people have is lack of information. We begin to do the wrong things, then we begin to get into trouble, and that is not the best. Okay, so if your baby is taking the normal food that you eat at home, that is actually the right thing for the baby to eat. So the baby does not need to take any special food they sell in the stores. Your baby does not have to take pap. Pap is not the only source of carbohydrate. There are many other sources of carbohydrates, including the rice, including yam, the tubers, including other cereals. So there's no law that say a child must take pap as part of complementary feeding. If the child doesn't want to take pap, and then the baby should definitely have pap with milk. I'm not sure why you think your baby should be taking milk without pap. If you should definitely be adding milk to the baby's pap. You can even add your breast milk to it, so that is fine. So, and you can add sugar, you can add dates. There are many ways to sweeten your baby's pap if you want to give pap. So all this information, like I said, you will get it in our guide section, and it is very important. I find that the most important thing is to have the right information before you even start complementary feeding, and which is why ACP is there for you. So go to our groups, go to the guide section, watch all the video. You can also download the app, Global Health Media. They put all the videos in an app called Birth and Beyond app. Birth and Beyond app is available on Google or what's it called, the other stores, and you can download the app. It is free. It is even available in all the languages, in Yoruba, in Hausa, in English. So you can watch those videos, and trust me, you will never see them use any so-called baby food or canned or tinned food. It will be the same food in your kitchen. They don't even use any formula, anything, and then they will still teach you how you can feed your baby without you having to go to any store to buy anything to feed your baby. So I hope you've been able to get that information, Khadija. So your baby seems to be the one who understand what the pediatrician has been saying. So, but you are worried because you don't have that information, but now you have the information, and you can get more of that information and from our website, from our Facebook group, from our YouTube channels, from all this our podcast platform. You get all this information, and you will be able to feed your baby properly. All right. Let me take one more question on Instagram, then I'll go back to Facebook. Bemolala. Okay, my almost 7 months old for meats and pools. When she takes any brand of formula, again, it's not compulsory for your 7 months old to take any formula. Your baby can take breast milk. So if your baby is not taking formating breast milk, your baby can get all the milk the baby still needs from the breast. So you can just give the baby breast milk, and all the other food you need to give the baby. I don't know whether you were listening to me when I was adding Khadija's question. It's the same thing. Your baby does not need to take formula as part of complementary feeding. As long as you are breastfeeding that baby, the baby will still get enough milk from the breast. And then every other food that you need to give your baby is in the in your kitchen, the same food you eat that you need to give to your children. You just need to make sure you understand the different classes of food and you begin to combine them properly. I've brought in nutritionists on this program before. We have videos on how to do all these things. So you may want to watch them so that we don't turn this ATP hour into a nutrition class again. But I would recommend that you go through all those videos I've mentioned about, because some children actually are allergic or they have intolerance of some of the, maybe the cow milk or the cow milk protein. So it's important that you know what to do. Some children are, they have dairy intolerance, so they can't take milk make from animal products. They have to take milk from plant products like soya milk and all that. But all those is not even necessary as long as your baby is able to take breast milk. So your baby will get all their milk from breast milk. So, and don't make assumptions of lactose intolerance. Don't, the fact that your baby takes breast, you give your baby formula and baby vomits or poos does not mean your baby has lactose intolerance. I'm very wary of parents making those assumptions, because then you go and start using that diagnosis that you made by yourself, which may not necessarily be correct. So the baby vomiting or passing through because you gave formula does not translate to lactose intolerance. That is not how we make the diagnosis. Such diagnosis has to be made by a pediatrician, by a doctor, not by you, because there are many other explanations for why your baby could be vomiting or throwing up or having diarrhea with a particular brand of formula. So for example, if your baby is taking breast milk and not throwing it up, that baby does not have lactose intolerance, because there's lactose in breast milk. So there are lots of information that would help us to decide what is going on. So that is why don't make those diagnoses by yourself. You have to see a doctor, a pediatrician preferably. We are the one that can make that diagnosis, and then that is when you should be able to use it. Don't make the assumption, because you make assumption wrong, then it's going to be the error will be perpetuated because you keep assuming, which is not necessarily correct. So please, number one, just keep breastfeeding and give your baby complementary feeding. But if you want to be clear about the lactose or no lactose, right, you have to see a pediatrician about that. All right, I think I will go to Facebook now, give Instagram a break, and come back to you later. So the first person on Instagram, uh, Annie Akon Esther, my baby is 11 months old and 2 weeks and yet to walk. Okay, that's not a problem. So your baby is already cruising. If your baby is not walking by 18 months, you can come back to us, but before 18 months, we're not going to worry. Some babies walk late. We don't even say it's late until 18 months, so we give everybody a little bit of allowance for catching up. So most babies work at 12 months anyway, so your baby is not yet even 12 months, so we're not even going to worry about walking. But if your baby is not working by 18 months, that is when we are going to worry. And you don't need to do anything. Your baby getting to stand, getting to crawl was not anything you did. It is the baby's brain developing. So you didn't do anything to get to the baby to this stage. So you don't need to do anything for going forward. The baby will walk when baby is ready. Just let the baby be. All right. Ogumola Fadekemi, is it true that a baby can't eat adult food prepared with salt? Again, these are all the myths and lies that people spread. So I want to just make a recommendation. Please don't take whatever anybody tells you when it comes to health of children, when it comes to what they can eat or not eat, if they are not professionals. Okay, so there's no law that your baby cannot take food that is cooked with salt. And I'm not sure how you expect you yourself cannot eat food that's cooked that is not cooked with salt. I mean, how do you eat it? It's so difficult to eat such food. So how do you expect your baby to eat such food? And these are the reason why babies struggle to eat. Their mothers will say, "Oh, pediatrician, maybe it's not eating," but we're doing the wrong thing first. So you can cook your food with salt, okay, for your children. You can even add sugar to the pap. There's all these things that parents made up by themselves, and then they begin to spread it to other mothers, and it becomes like a belief, a myth, and it's widely believed. And so please listen to the pediatricians when it comes to those issues. Don't even listen to other fellow mothers when it comes to those kind of things, because there's a lot of misinformation. So your baby can take food cooked with salt, your baby can take white sugar put in the pap. key word is moderation. Okay, we don't want you to load, and there are so many things that you people give to children that are actually loaded with salt, more than even the one you put in your food at home. All right, so most of those things that are sold in tins and cans, most of them actually are loaded with salt, because that is the only way they preserve some of them. And you don't even think of those ones as source of salt. And even all these your beverages that we give to our children, most of them are loaded with sugar, but you are not even thinking of that. But it's the food you cook at home that you're thinking, oh, I should not put sugar, I should not put salt. But all those other ones you're buying in the shops, they are actually loaded with more uh quantity of sugar and salt, if I can put it that way, which is why we don't recommend it, which is why we prefer that you cook your food in your kitchen, and you can put a little salt to taste, you put a little sugar to taste. There's absolutely nothing wrong with that. And you can also use other natural methods to sweeten your baby's food. There are fruits like dates that can sweeten your pap if you don't want to use natural sugar. But please don't give honey, don't use honey. Some people say, oh, don't use sugar, go and use honey. No, don't use honey for children below the age of 1 year. There's a risk of what we call infant botulism, which is more dangerous and can kill a child. So don't use honey for children below the age of 1 year, but you can use your salt, you can use your white sugar to make, and you can use milk, and you use age appropriate milk or your breast milk. But from the age of 1 year, you can use the same milk that the rest of the family uses. So I hope that is helpful. Father Kemi. My baby is 9 months. Can baby drink tea? No. Okay. Okay. I think today is going to be another nutrition class. Okay, your baby should not be drinking tea at 9 months. The only beverage a baby should take at less than 1 year is water and milk. Nothing else beyond that. So please don't give tea, so-called Nigerian tea. Well, your beverage drinks, all those chocolate beverages and all that. I'm not going to mention any brand names now. Don't give them to your children. The only beverage babies, infants less than 1 year should take is water and milk. It can be the breast milk, it could be formula that is age appropriate, but definitely not so-called tea and other. Again, we have a whole guide section on healthy drinks in children. So if you want to watch that, you may also want to go to our guides, to our groups, and watch the guide section. There's guide 11 is on healthy drinks. What are the drinks for each age group that are appropriate? So I recommend you also watch that as well if you want more information. All right, Abigail Igojo, you're asking, um, good evening, doctor. Please, how do I know if my baby is allergic to a particular food? Okay, there are signs that we do see in children who have allergies. Most of the time, they can break out with rashes. The most important thing with allergies is that those symptoms will only happen when the child takes that particular food. They will not have those symptoms at other times. So if anytime you give a particular food to your child, the child start having symptoms like skin rashes, itching, some of them may vomit, some of them may, retch, their tummy may become distended and all that. It may be a form of food allergy. And when you stop the food, you will notice that all those symptoms go away. Then maybe after a couple of days, you give that same food, you will see those symptoms all over again. Those are the first indications that this child may have what we call food allergy, because children can react to virtually any food. So I know children will react to egg, I know children will react to fish, I know children will react to milk. So, and people who have food allergy, they can't even take anything made with those products. So you can't say your child has milk allergy, for example, and your child is eating biscuits or eating bread or eating cake. The children who really have through milk allergy, they won't even be able to take biscuits, because any product made with milk, they won't be able to take it. They won't be able to take cake, they won't be able to take anything, ice cream, anything made with milk. So that is true food allergy. So those are the first thing. You will notice that these symptoms only happen every time this particular food is eaten. That's number one. Number two, there are way by which the doctors, we can do tests. So we can do tests in the lab. We call it a challenge test. So we introduce the product to the child, in a way we can monitor, and then we will see those reactions, and we will then we can confirm that this child has true food allergy. So please don't make diagnosis of allergy without a doctor, because we can be wrong. Okay, there's also food intolerance, which is different from food allergy, but I'm not going to go into those jargon today. I'll just leave it. All right, so I noticed that if I give a particular baby food, a face, especially a bound, will start having reddish rash. It's a possible thing. Again, baby food, can we just take out this baby food? Okay, today is baby food about, so there's no so-called baby food. Please give your baby food, give your baby natural food from your kitchen that you cook by yourself. It's far, far better than some of these products that we buy in the shops. They have to add additives to those things. And sometimes, for example, if you're giving a particular product from the shops, it may not even be the real food inside. It may be what they use to preserve it. There's a particular drink I used to take then. I noticed that anytime I take that drink, I would just start having this kind of breathing and itching and all that. So I know it's the allergy, but I don't even think it's the product like the orange or another. I think it's what they use to preserve it that is causing me to have the reaction. So you really want to go as natural as possible when it comes to treating your children, so you avoid the additives that could be causing the allergy, because now you're going to give the pediatrician a lot of work to figure out which one. But I think the best option is to actually just stop whatever you think your child is allergic to. Just stop it, and that's it. End of story. Remove the trigger, the allergy symptom will stop, and you can go for alternative to replace whatever the child is allergic to. All right, so let's go on. Instagram people, if you have question, please ask, because your own question goes fast. So yeah, Abigail, because you are just about to start feeding your baby 6 months, so please go to the guide section, watch all those videos. Just stop whatever you're giving now. Your baby does not need any baby food. Just still give breast milk. You still have a couple of minutes or days to just go and learn how to go about complementary feeding properly. And like I said, even when you give your baby pap, you can just use your breast milk as the pap, as the milk for the pap. You don't need to buy any baby food if your child is having allergies to them. All right. Fadekami, you've asked about the salt. I think we've answered the question. I hope you listened. So I hope you are still with us. Let's move on. So the next question is by Barbara Shooks Okafo. How many liters of water can a baby of 7 to 12 months take in a day? Okay, so the baby does not need liters of water. Okay, so for your 7 month, you should give us what is the age of this child. It's not like 7 to 12 months old baby. Okay, so let me just take the 12 months old, which is the upper limit. A 12 months old baby weighs averagely 10 kg. So 10 kg baby just needs 1 liter of liquid. Okay, 1 liter of fluids in a day. 1 liter. That is all they need in a day, and which means that your baby is taking. If your baby is taking breast milk, is all of them counts as part of the liquid that the child is taking. But if you are not even sure how much baby is taking from all the other ones, at least you cannot give that baby beyond 1 liter of water. But your baby does not even necessarily need 1 liter of water, because remember your baby is taking breast milk, so it's getting water from that. 70% of breast milk is water. So depending on how much volume of water how much volume of breast milk you're giving, so there's water that your baby is taking pap or any other liquid uh food. There's also some water inside that, but all together, breast milk, any other liquid, water, everything should not be more than 1 liter in 24 hours minimum. Of course, if you take extra like 1.2 liters or 1.3, nothing is going to happen. You're just going to pass the excess out in urine. So it's just around that range of liquid that we expect for a 1 year old. For your 7 months old, is less, obviously, because if your 7 months old is weighing averagely 8 kg, your 7 months old should not take more than 800 mils of water in a water, fluid, everything liquid in a day. I hope that's helpful. So each time you feed your baby, give them water to drink after taking solids. Make sure the child take fruits. The constipation is not just about water only. The child needs to take food that are rich in fiber. Okay, so especially fruits, vegetables. Those are very good examples of food that are rich in fiber. Oats, very good source fiber as well. So for try to avoid all these so-called baby food that you buy in the stores that are already over processed. Try and give your baby as much of this natural cereals and vegetables and all fruits, then your child will be able to move the bowel more frequently, and of course they should drink water as well. So I hope that is up for yeah. Okay, let's move on. Adams Ajarat, good evening, Doc. Please, does flat said in newborn baby have any effect on the child's development? No. So, number one, who made the diagnosis of flathead? Is so was baby born with it or not? Because the shape of the baby's head at birth is different. Because when babies are going through their mother's birth canal, their head tends to compress, okay? Because they have to be smaller so that they can easily pass out of the birth canal. So there's what we call overriding of the sutures, the bones of the skull, they're actually movable. They can move and go on top of each other for the baby to come out. After the baby has come out, then over days, the head will reshape and all that. You don't need anybody to say they are molding the head or pressing the head or doing so that the head will be rounded. No, you don't need, just leave it alone. The baby's head will be normal. Some babies, especially for preterm babies who tend to lie on the back for a long time, then the back of the head may be flat. And again, it's not something we worry about. As they get older, things will reshape and another. But actually, for some children, they have what we call abnormal fusion of those sutures for different reasons, and they can actually have flat head. We call it different names, so I will not bother you with the medical jargons. But those kind of babies are the ones that have truly flat head. But again, what is the implication? Nothing. As long as baby's brain is developing, there's no other issue with the baby. We don't tend to do anything about it. So most of the time, we just tell you to just leave it alone. And as the child gets older, most of the head shape tends to remodel and all that. So we don't tend to worry about it. It's all right. I'm always checking Instagram so that I don't miss. If I miss your question on Instagram, please ask again because the questions are disappearing fast. Okay. Ogachiku is asking, is it advisable to give paracetamol after vaccines? You only need to give paracetamol if your child has fever. It is not a routine thing that you must always give it. But there are some vaccines that we are pretty sure your child is likely going to have fever. It's only the 6 weeks, the 10 weeks, and the 14 weeks. They are really, because there are about 7 or 8 vaccines we're given at the same time in those age groups. So the children tend to have fever, especially from the DPT part of it. So you can give them paracetamol after the vaccine has been given. So last week on ATP Hour, I talk about immunization again. I give a lot of updates. You may want to listen to that or watch it on whichever platform you are right now. So it's okay to give paracetamol after immunization if your child has fever. And does the paracetamol reduce the effectiveness of the vaccine? No, that is a myth. That's another one lie. And I know there was a time people were spreading so much lies on Facebook about paracetamol causing problems. A child died because no, it's not true. All right. And the paracetamol, I actually mentioned this last week as well. So you may want to listen to my ATP podcast or our ATP hour on the podcast on YouTube or on Facebook. They're all still there. Just watch it again. I mentioned this. Paracetamol does not reduce the effectiveness of vaccine, okay? Paracetamol reduces the fever, okay? It does not reduce the effectiveness of vaccine. Please don't listen to all this our fake fake people that are spreading all sorts of lies. Most of them don't even know what they're saying. They don't even understand the what we call the pathogenesis, how all these things work, how things happen, what causes fever in a child who has gotten vaccine, all right, and how does the paracetamol work. So I won't bore you with all those jargons, but just for you to know that paracetamol does not reduce the effectiveness of vaccines. So if your child has fever, please give paracetamol. All right, I have a question on Instagram. Let me quickly take it before it disappear. Naomi, he said, "Good evening, Doc. What makes a 10-year-old to be having chest pain?" Oh wow, chest pain is not a good sign. She feels the pain on her back. There are many causes of chest pain. So basically, anything around that chest area could make a child to have pain, starting from things on the skin. to things on the muscles, to the bone. For example, if a child lifts something too heavy with their hands because the muscles from the hand that joins to the one pulling on the chest, you can have pain. So we call that musculoskeletal causes of chest pain. Or if you have a wound or a boil or something on the chest, well, you can have chest pain from that. Those are things that have to do with the skin, the muscles, or the bones. But you can also have chest pain from the heart, the heart problem. You can have chest pain from problems that has to do with the lungs. Maybe the child has chest infection, pneumonia, you cough, you feel chest pain. So there are many things that can cause chest pain. So what you need to do is to see a doctor. So there are many questions we ask the child, and when we ask the questions, then we can go to know which of the multiple hundreds of causes of chest pain is responsible in this particular 10-year-old child. So please see a doctor, a pediatrician, and then they will be able to tell you what. Okay. Testing positive for H. pylori does not necessarily mean anything. Okay. A child could have peptic ulcer and they can have chest pain, but it's more of a chest bone kind of a pain, so there are different causes again. That is the job of the doctor. They will be able to ask the questions, they will be able to narrow it down. And the way the pain is the pain going somewhere? Is the pain in one particular place? Is it always there? Does it come and go? There are like 10 questions on pain alone that we will ask you, and that will help us to narrow it down. Is it something from the heart, from the lungs, from the bone, from the muscle, from the skin? So that will help us to know where the pain is from, and then we can now take it up from there. So without doing all those details, we even have to listen to the heart, listen to the lungs, listen to the heartbeats and all that before we can make up our mind as to the cause of the chest pain. So please see a pediatrician for proper evaluation. All right, can I give my 21-month-old toddler stop-bought juice? You can always give your child juice if you want, but it's better to give your child fruits that you express the juice. That is the best. Okay, but if you want to go buy the one in the shops, please read the contents, read how much sugar they've added, read whether it's concentrate or it's natural. There are natural juice as well, but because they don't last too long because preservatives. So some of those ones are more expensive, but most of the ones that they just give concentrates and they just added sugar, top up with water, it's not good for your children. So you can give, but usually the best option is for you to actually buy your own oranges, squeeze it out for your child, you know, and that would be the best. No additives, no preservatives, much better and all that. Okay, Jonathan Magdalene, Jonathan, I'm not sure I've seen your first question because it's my second question. So I'm not sure we saw the first question. Okay, I've seen your first question. You're the one that asked about tea in the 9 months old. Okay, so my second question is that my baby only suck. It doesn't eat any other food. Definitely your 9 months old should not just be sucking. Your 9 months old needs to eat other food, okay? So you need to definitely see a pediatrician. If you have not watched our globe, and that's not the child you want to give tea. A child who is not eating, then you want to go and give tea. That's called insult upon injury. You are going to have problem with that child developing malnutrition. So don't even start with any tea in that 9 months old child. And breast milk is not enough for a 9 months old child. The 9 months old needs to eat all the other food, okay? And you need to be patient and you need to be persistent. So you really need to go and watch our global Ed media videos on complementary feeding. It is so important. And also on that our guide section, we have lots of tips on how do you feed your child, how do you make the food, what are the tips to get children to eat, using colorful plates, making the food, the way you prepare the food, let it be thick, let it be colorful, let it be inviting. I hope you're not one of those people who will not add sugar to make it tasty, or who will not add salt when you're cooking food and the food is bland, it's tasteless, and you expect the children to eat it. They're not going to eat them. And there are lots of people on social media as well who have developed all these baby kind of recipes, lots of recipes. I mean, I'm not going to go into that. That's not my job as a pediatrician, but there are people that have done that. You may want to experiment with all this recipe. Your child needs to eat, or hey, that child is going to develop malnutrition, and that is not the child you want to win. A child who is not eating, the child is only taking breast milk, and then you now want to go and stop the the breastfeeding. No, that's not is a wrong decision to take at this time. you need, number one, you want you to breastfeed your baby for at least 2 years minimum. But if at all you don't even want to breastfeed for 2 years, but this is not the time to stop winning to win the child. So what is that going to be on? Because your baby is only taking breast milk, and now you want to win the child. Then what do you want the child to be on? Then the child is going to develop malnutrition, and which is dangerous. So please, this is not the time to win the child. Your baby is you're having wounds on your nipple because your baby is also not sucking properly. Your baby is sucking on the nipple rather than having the whole of the breast, nipple, and the areola in the mouth. So again, you also need to watch our guide on breastfeeding, how to attach your baby to the breast. That is number one. You need to get your nipples treated for the wounds, so hopefully it will heal. But you need to feed your baby properly, and don't even start winning a child who is not even eating much. You are going to create um a setting for malnutrition, and that will be very, very dangerous for the child. So please, if you need more help, see a pediatrician, see a nutritionist. They are able to give you support with that. So I hope that is helpful, Jonathan. If you have any more questions, I mean more clarity, feel free to ask. All right, let's move on. Yahweh's pride. Okay, can a mom only feed her baby on one breast? No. All right, no. There's the reason why God gave you two breasts. Okay, please feed your baby on the two breasts. Okay, whether you are winning, whether you are not winning, and actually it's for your own good as well, because if you feed your baby on one breast, you are going to have unequal breasts. Okay, then some of you say, "Oh, my one breast is big, one breast is small." That is why, because what you don't use, that's the law of nature. What you don't use becomes smaller, it atrophies. There's what we call disuse atrophy. So when you don't breastfeed on one breast, it will be smaller, and the one you use will be bigger. And some mothers wonder, oh, why my breast not equal? So you should use both breasts. So when you are trying to win your baby, it is not by using one breast, it is by reducing the number of hours or the duration of the breastfeeding. So if you have been breastfeeding throughout the whole day, you may want to reduce it only at night. That is it. So it's not like you only use one breast, but you use both breasts, but you may not breastfeed during the day or in the afternoon, and just breastfeed only at night. And then when you're ready to stop, then you just stop completely. But if you do only one breast, you are going to be the one to suffer, complaining of your breast being unequal and all that. And this also applies to those who are not winning, because I notice some mothers do that as well. They will say, oh, because some of us find it easier to breastfeed on our dominant hand. So if you are right-handed, it's easier for you to always put your baby on the right. But and the other vice versa. But you must deliberately and consciously make the effort to make sure you breastfeed with both breasts and you alternate them. So when you finish with this one, the next time you are starting, it must be the other one, and back and forth like that. Never use only one breast. Okay, some people say, oh, maybe doesn't like to suck the second breast. It's not true. It's because you are not giving it. And if your baby doesn't like someone breast, start with that breast first. Okay, especially when your baby is very hungry, when they will take anything you give to them, you start with that one, and then you go to the other one. Their breasts are supposed to be two, and that is why God gave you two, and you're supposed to use the two of them, not one. All right, so please, if you need more information, again, our breastfeeding guide will be very helpful. All right. Ajayi Edema. Can a 1 year old baby take Zobo drink, prepare at home? I don't know why we have so much craziness about this Zobo. I think it's hibiscus flower and all that. Um, just be careful what you give your children. If your child is allergic to any of the things, especially some of the things people had. Some people are having ginger, they're having this, they're having that. Some of them could be dangerous for your child. So um I'm not really particularly a big fan of this sober drink or what is inside. I'm not really sure what it is. So I won't really make recommendation, but just be careful that your child is not allergic to some of these things that we are giving. So that's just my own note of warning. But then I'm not an expert on it, so I won't be able to say that. Omoke Abigail, how can I make my baby to be sucking breast frequently? By putting the baby to the breast. There's no other way. Just make sure the baby, you keep offering the breast. Always tell us the age of your baby. You've not told us the age of your baby and all that, so it's difficult to say. But if your baby is a newborn baby and you're just starting breastfeeding, all you need to do is to breastfeed what we call on demand frequently. So you should breastfeed at least nothing less than every 2 to 3 hours, and you alternate the breast, okay? And just make sure baby is well attached to the breast. Some of the babies are not breastfeeding because we are not attaching the baby well to the breast. So if you're attaching the baby well to, if you're not attaching the baby well to the breast, then that baby will be frustrated because when they suck on the breast, nothing is coming out. Really, when you're only putting the nipples in their mouth, so you must make sure that you put the baby not just the nipple but the areola. So I think I need to get the breast model and have it with me because I'm always answering this question and I'm always lying to explain. So the part of your breast that is jutting out, that is your nipple, but the black part immediately beyond that nipple is the areola. That areola is where the milk banks, the what we call mixed sinuses, that is where they are stored. So please always make sure your when your baby wants to breastfeed, make sure the mouth of the baby is open wide and make sure they latch onto the areola, not the nipple. Okay, because most babies when they are rushing, they just grab on the nipple. And when they suck on the nipple, nothing is going to come out. Nothing is coming out. And that's why some of you end up having engorged breast. And because the milk is not flowing out, so the breast milk just keep piling up in your breast and it's hard, it's painful, and the nipple, baby is biting on it because it wants something to come out. Nothing is coming out. So baby is frustrated and you develop all these wounds on your nipple because the baby is biting on the nipple and not the areola. And then the baby is frustrated, they will cry because nothing is coming out, then they bite more, and then you develop wounds, you develop breast engorgement, which you end up having mastitis, infection in the breast, or even breast abscess. All these are preventable by us making sure we get that attachment right. I always tell mothers breastfeeding is 90% attachment. We must get the attachment right because when the baby is latching onto the areola, when baby bites on the areola, the milk is just gushing out like tap into their mouth. So baby is sucking well, they are swallowing it, and they are happy. And you too, you feel your breast empty, and your baby will be happy. Then people want to suck more. So your baby is not sucking. It's either the baby is sick because babies are naturally wired to suck. So the baby is not sucking. It's either they are sick or they are not grabbing the breast properly. They are not attached to the breast properly, and that is your job to do. So for Abigail, you need to go to our guide session. We have videos that shows you how to attach your baby to the breast, how to breastfeed, how to even position your baby, how to rest your back, how to cross your leg, how to put the babies. All these things are very important. Breastfeeding is not, it doesn't come naturally. Sometimes we need to teach mothers how to breastfeed. So we need you to watch those videos, very lovely videos, and it will help you to know how to attach your baby to the breast. And then, you must alternate the breast, you must feed very frequently. So if you are doing all the right things and your baby does not still want to suck, it may mean the baby is sick. For example, children who have heart problem, holes in their hearts, children who have weakness of muscles and all that, they may not want to suck, children who are ill, and then we need to treat those children differently. So please, you have to see them, but most of the time it's nothing with the baby, it's because of this technique that we need to get properly. And once you get the technique right and you just keep offering the breast, babies want to suck most of the time because they love sucking and they are wired to suck. All right. Yahweh's pride, you're saying um your babies eats family food. Okay, but the way you process your question again, you said you are the same person. Okay, Yahweh's pride, you are the one that was asking about breastfeeding on one. Yeah, you can win your baby. I'm not saying you cannot win your baby, but you have to breastfeed with both breasts when you're winning. Not one breast when you're winning. So I'm happy your baby is eating family food, so it's okay to win. You didn't tell us the age of your child. You should always tell the age of the child. But more importantly, you need to make sure that you breastfeed both breasts, and when you're stopping, you stop at the same time. So I hope that is helpful. Okay, your baby is a 1 month old. Yeah, I can see your baby is 1 month old, so your baby needs to suck. So your baby is not sucking. It's not that the technique is wrong or there's something wrong with the baby. If something is wrong, you have to see a pediatrician and we can help you with what is wrong. But I have a feeling most of the time it's our technique that needs to be corrected. All right, Instagram people, let me know if you have questions. I'm checking. All right, let's move on to the next question. Temidayo Abayemi Alao. Please, my is it true that as soon as the baby is born, there are drugs to be given daily? Of course, it is not true. It is not. These are myths that actually have a lot of product for newborn mothers. I call it first time mom companion, and I address all these questions. There's also the 500 frequently asked questions. Again, I address all these, and all these myths are addressed in those products. They're available digitally if you really care, but it is not true, all right? Babies do not need any drugs. None, no drugs at all. Okay, the only thing your newborn baby needs is breast milk, just breast milk only, no drugs. So there's no drug that should be given daily, and we need to stop this Ajogba syndrome. That's what I call it. Ajogba syndrome. Our Nigerian Yoruba mothers especially know what I'm talking about. Once a baby is born, they have this big bowl Ajogba, and they have all these drugs, paracetamol, Bona babe, Nospami, grape water, Gbomoro, this, that, and once the baby is given their bath in the morning, the next thing they do is to just be dropping everything in the baby's mouth. Please, no, this should stop. You don't need to give any baby do not need any single drug at all from you. The only baby that will need drugs are people who are sick. So okay, if a child is sick for any reason, then the doctor will prescribe drugs. Usually we prescribe it for 1 day, 1 week, whatever, but and that is it. Not something the baby has to be taking every day, every day. I know people who give their babies paracetamol every day, and then you're going to damage the baby's liver. There are people that give all this so-called teething powder from day one the baby has been born. Some of these drugs are very dangerous, damaging the liver, damaging the kidneys of our babies. And then down the line, wonder, oh, why is this child having chronic kidney problem? Why is he having liver problems? Some of the things we've done when babies are born. So please and please do not give all these things you listed. They are not necessary. Even the multivitamins, they are not necessary, because if you as a mom you're eating well, eating your fruits and getting your own vitamins, everything your baby needs you are going to give the baby through your breast milk, including the vitamins. You are going to pass it to the baby through your breast milk. The breast milk is a complete food and water and drug, everything for the baby for the first 6 months of life. Your baby does not need any drug whatsoever. It's definitely not nothing that you need to give every day. So please do not give babies drugs. Just give them breast milk and breast milk only. So that's it. And luckily for ATP, we have lots of testimonials, because these are the things we've been teaching for the past 9 years. Okay, come July 9 to be 9 years since we've been on Facebook, and a lot of mothers could testify that they'll be able to do that, give their child nothing, breast milk, and the children are fine. Nothing is wrong with them. So please don't. There, in fact, I used to say that, not me, but it's a common popular saying that all drugs are poisons. Okay, it's a common popular saying. All drugs are poison. What makes the difference between a poison and what is helpful is the dose. Okay, so there's no amount of drugs that you can give that sometimes you will move away from it being beneficial to it being a poison. So the best thing is not to even use any drugs at all, okay? Except when it's absolutely necessary. And when you give what is not unnecessary, you are causing problem. And babies' livers, organs, still so tender, still not so mature, and we're giving them all these drugs that have all these horrible side effects. You are causing more problem for them. So please just breastfeed your newborn babies until they're 6 months old, unless they are sick, because some people now say, okay, I like to qualify my answers, because somebody will now say your baby is actually sick, ask me if you're having sepsis or malaria, and the doctor now prescribe drugs. Then you now say, doctor, give me a say my baby should not take any drugs. No, if your baby is sick and your baby has to be treated, your doctor will write the drugs. Then you treat the baby. Maybe it's 3 days, maybe it's 5 days or 7 days. But there is no drug that you have to give the baby every day. Baby who is well, there's nothing wrong with the baby, nothing like that. So I hope that is clear before misquoted. I get to be misquoted a lot of the time, so that's why I like to clarify. All right. Our time is running up. I have 7 more minutes. And Abigail is asking 4 kg okay for your 8 weeks old baby. Baby was 2.8 at birth. It's not so bad. It's okay. I'm not worried. If your baby is gaining weight, that is good. So most babies gain averagely 900 grams every month. Sorry, 30 grams every day. So if your baby has gained 1.2 kilos in 2 months. That's not so bad. So just keep breastfeeding your baby frequently and on demand. So I hope that's helpful. This week, I think today or tomorrow is the World Asthma Day. I'll be talking about asthma, bronchial asthma, in on Thursday, ATP hour Thursday. I have just 5 more minutes left on this program, so if you still have any questions, it's time to ask. But if you don't, if you remember your questions after I've gone off live, feel free to go to Ask the Pediatrician Facebook group and post your questions there, and we will be able to answer your question as soon as possible. But just to let you know, I'll be talking about bronchial asthma on Thursday, ATP hour, World Asthma Day. And the theme of this year is actually about health education. It's a very important thing when it comes to asthma. So it's going to be something you really need to listen to. And asthma is actually one condition where we give parents permission to do self-medication. Yes. So even though we always say we don't like self-medication, we don't like self-medication, when it comes to asthma, we actually give you the permission to do self-medication. Asthma is sometimes we say parents actually manage asthma. Parents have to manage asthma because most of the time when the symptoms start, the doctors will not be there. So parents, we have to give you the power, we have to give you the education to know how to handle asthma. And of course, there's still lots of myths around asthma, and parents are so scared. People don't like asthma label. They do, and unfortunately, it's one of those conditions. If you don't know the diagnosis and you don't have the right tools, uh, like I said, parents have to manage asthma. It can kill actually. So we will be talking more about asthma on Thursday, just to whet your appetite ready. But said Abdul, how can I increase the appetite of a 4-year-old after using several multivitamins? I'm happy that you've said that you've used several multivitamins and you are still asking these questions, which means that the appetite is not increased by multivitamins. I don't know who spread that lie or who started it in Nigeria that if you want your child's appetite to increase, then you give multivitamins. It is not true. Multivitamins are not appetite stimulants. And generally, pediatricians, we don't recommend appetite stimulants. We don't. We know there are drugs that have side effects of appetite stimulants, and people actually sell them as appetite stimulants. But those drugs are actually not meant to be appetite stimulant. There is no drug that is licensed or recommended by pediatricians for purely to be appetite stimulants. We don't give appetite stimulants in children. What you need to give your child is still food. Okay, so if you want your child's appetite to increase, you give them food, and you give them food, and you keep encouraging them to eat food, give them fruits, give them veggies, no drug whatsoever. And giving multivitamins is not going to increase their appetite. So you just have to. So what is important for us is the weight of the child, because sometimes parents say, "Oh, I want baby to eat more," but the child's weight is okay. So whatever the child is eating is enough. We don't look for more trouble down. We have enough on our plates. So if you tell me your child's weight, if the weight is fine, it means that whatever the child is eating is enough. It may not be as much as you want, but if the child is eating enough, it is enough. The weight is good, the pediatrician is not going to worry about it. If the weight is not good, then we will worry about it, and then we'll look for how do we sneak in the calories into this child. Sometimes we have to do smoothies. Sometimes the dietitian will give you what we call like sachet kind of prepared food that you can add to whatever the child likes, even though it's small quantity of it, but it will increase the calorie intake for the child, and then the weight will go up. So we are more interested in the weight of the child, the health of the child, rather than how much they actually finish off their plates. Parents sometimes worry about how much the child actually finish off their plates. So the child is already having good weight, but because it's not hitting the quantity you put on their plates, parents worry about that. We don't worry about that. We worry about the weight. So you cannot ask about a child's appetite without telling us the weight of the child so that we can work out whether we should even worry or we should not worry. But what I always recommend, just give them whatever they like. Give more whatever they like to eat, and gradually be introducing new things. Sometimes you may need to hide veggies in your smoothies or in the way you cook your food. There are different tricks and tips around that. But drugs, no, there are no drugs, no appetite stimulant drug is recommended. The so-called super appetite heptadine that people sell, we don't recommend it for children as appetite stimulants. Those drugs are dangerous. They have dangerous side effects. Please don't give them to your children. What is the best position to lay a baby of 0 to 3 months? Is it when baby is sleeping? Back. Always back to sleep. Always back to sleep for every baby for the first 1 year of life, even beyond. Back to sleep. Never on their tummy, because sudden infant death syndrome is real and we don't want our children to have sudden infant death syndrome. What causes jaundice in newborn? There are many causes of jaundice in newborn. That is a whole topic on its own, which we have done. So you may want to go look for on our website. There are 2 website articles on jaundice. There are podcasts on jaundice. There are videos, ATP hour on neonatal jaundice. You will need to watch them because you need that lecture for an hour. So just to summarize by saying jaundice can be normal, what we call physiological jaundice. Most babies will have jaundice. 60% of babies are going to have newborn jaundice. 80% of preterm babies will have newborn jaundice. So it's a very common condition in newborn babies. Jaundice can be normal actually for those babies, but jaundice can also be abnormal. Jaundice can be due to blood group incompatibility. If the mother is whole, the baby is A or B. Mother is rhesus negative, baby is rhesus positive. Baby has infection, baby is born premature, baby has some abnormal, what we call GCPD deficiency, so many other things, biliary atresia, so many causes of jaundice. But that is the job of the pediatrician, to first of all confirm the baby has jaundice and to investigate the cause of the jaundice, and more importantly to treat jaundice, because jaundice is an emergency. Even though I said jaundice can be normal, it can also be an emergency because jaundice can cause brain damage if it is too high in the blood. So we need to know the level of the jaundice, we need to know the cause of the jaundice, and we need to treat. So some jaundice don't need any treatment. If it's a normal jaundice, the baby goes home. If it's a mild jaundice, baby may need phototherapy. If it's a severe jaundice, baby may need for us to even change the blood. So that is the discussion on jaundice in 1 minute, I hope. But if you want the details, you have to go read either on our website or go on the podcast or our YouTube channel. Just type in jaundice into the search button. You will have those videos and the articles that you can read for details on jaundice. All right, my time is up. I gotta go. Thank you so much for joining me. I really appreciate you. It is not easy to come online and there's nobody at the other hand. So thank you so much for joining me. But if you still have questions, you are free to go to our website. Not our website, sorry, our Facebook group. Go to our Facebook group, Ask the Pediatricians. You cannot miss our Facebook group. It is 720,000 members strong. So definitely you will know when you're on Ask the Pediatrician, because there are some other ones that are not our group, but the names are similar. So that's I always like to tell you about the membership strength. So you will know when you're on the right group. And of course, you should see me there or see my post, so you will know you're in the right group. So you can ask your questions for children on Ask the Pediatrician Facebook group, Mondays to Saturdays. We don't do questions on Sundays. We take a break. We need 1 day for our own well-being. So Monday to Saturdays, you can ask a question any time of the day. Give us a few hours, even a day or two, we will get to you. Of course, if you have an emergency, please don't post on our group. You have to go to the hospital. That's where you're going to see me and see my colleagues as well. And if you on Thursdays 10 a.m. we do have a teaching, and like I said, this week I'm going to be teaching about bronchial asthma. We're going to be empowering parents. We've done it before, we'll do it again. There are some topics we just have to talk about every year. Last week I talked about immunization. So if you have not listened to the ATP hour on immunization updates, please do, because there are updates on immunization. Immunization does not end again at 15 months. Our immunization now ends at 9 years. Okay, we've introduced HPV into the immunization schedule. So please, you really want to watch that ATP hour on childhood immunization updates for those in Nigeria especially. And this Thursday, I'll talk more about bronchial asthma. Thank you so much for joining me. I appreciate you, and see you again on Thursday. But of course, we're always on ATP group. And if you have adult health questions, we have ATP family as well. You can also post your questions there. So have a wonderful, wonderful evening. And it is bye. Bye bye.